Welcome everybody. My name's Tracy. I'm one of the educators for the emergency program in the critical care program. Today, we will be reviewing your Code Blue orientation so you can familiarize yourself with the Code Blue process before you begin your employment here at the Grace Hospital. We're excited to have you join the team. We look forward to working with you in the future. Welcome to the Grace. Regardless of where you work in the hospital, it's important to understand how to call for help when you need it and know that help is just a call away. To start, let's discuss what a Code Blue is and when it's appropriate to call one. A Code Blue indicates patient decompensation and a request for immediate medical assistance from the Code Blue team. This can include cardiac arrest, respiratory arrest, or pre-arrest situations. Basically, any situation where a patient's condition has changed significantly from their baseline. This may include, but not limited to, heart rate less than 40 or greater than 140, respiratory rate of less than 8 or greater than 30, oxygen saturation less than 90% despite oxygen therapy, increased work of breathing, altered level of consciousness, cold, clammy skin, decreased pulses, decreased urine output, altered perfusion, restlessness, or agitation. We emphasize calling a Code Blue sooner rather than later. When a patient is in pre-arrest, the team has more treatment options available. Waiting until the patient is pulseless limits the intervention and increases mortality. ACP status is an important piece of information that you should review during a report. All admitted patients should have an ACP status addressed and documented within 24 hours of admission. There are 3 ACP designations. ACP-R, resuscitation. R means full resuscitation, including CPR, defibrillation, intubation, and advanced life support. C is for comfort care. C means comfort care only. No resuscitative measures are performed. M means medical care. Do not attempt resuscitation. These patients still receive active medical treatment, but this excludes chest compressions and defibrillation. This could include interventions such as ICU admission, intubation, vasopressors, surgery, or invasive procedures. Please make sure you are calling Code Blues for these patients, as there are a lot of interventions that ICU can do apart from CPR and defibrillation. There is an area on the bottom of the form that allows the physician to better articulate the patient's actual wishes for resuscitation. Never hesitate to call a Code Blue for ACP-M DNAR. There are several ways to activate a Code Blue response, depending on where you are and the resources you have available. On any black desk phone, dial 55. The operator needs 2 pieces of information. Number 1, the type of code, and number 2, your exact location. The operator repeats the call from the staff member, activates the chimes, and calls a Code Blue. It should sound something like this. Code Blue, Emergency Department, Room 17. It is normal to feel nervous or unsure. Take a deep breath, collect your thoughts, and listen carefully to the operator. When the operator has called overhead, make sure you listen to confirm the correct location has been broadcast. You will hear 3 chimes, then the announcement. If your area has a Code Blue button, press it immediately. This activates the Code Blue response automatically. Your location is automatically sent to the operator. If you do not have access to a phone or button, shout for help. Stay with the patient and begin CPR if necessary while other staff members activate the Code Blue. Pull the call bell out of the wall so the room light flashes. This alerts nearby staff and helps the Code Blue team identify the room quickly. It's important to know that this does not activate the Code Blue at switchboard. Another staff member will need to pick up the black phone and dial 55 to report. If you are wearing a Voicera badge, you can activate a call to switchboard by pressing your command button. Say, dial extension 55. Your Voicera badge will connect to the switchboard operator and you can report the Code Blue. If the patient has no pulse and is an ACPR, start chest compressions immediately. Early compressions are proven to drastically reduce death rates by preserving blood flow to vital organs. Early compressions are a part of your chain of survival from your basic life support. If this chain is broken, the chance of getting return of spontaneous circulation is greatly reduced. If you are unsure what the ACP status is, or it's unaddressed, assume they are an ACPR and start compressions. Additional team members should gather things you will need. Grab the Code Blue clipboard, airway basket, a hard board for CPR, and a stool. Have your educator show you where your equipment is stored on your unit. Once your supplies have arrived, place the CPR hardboard under the patient unless they are already on a solid surface like the ground. Utilize the CPR stool to better position yourself to provide quality compressions. Allocate a nurse to take over the airway and provide breaths using the bag valve mask. Compressions should continue uninterrupted while breaths are delivered approximately every 6 seconds. We will also need the patient's chart, their MAR, and Cardex from the desk. If your area uses an electronic patient record, the Code Blue team may also need access to a computer or workstation on wheels. One staff member should begin documentation immediately using the wall clock as the real time until the code cart arrives. Clear unnecessary equipment and personnel from the area. This allows the Code Blue team to enter quickly and work safely. Send somebody to meet the team at the elevator and direct them to the room. Family members may remain in the room if they wish. Assign a staff member to support them and explain to them what is happening. The ICU Code Blue team includes 2 ICU nurses, 1 healthcare aide from ICU, 2 respiratory therapists, and a physician. When the code is called overhead, the Code Blue nurse will turn on the defibrillator, which starts the run time or clock on the defibrillator. When the code team arrives, please document that they have arrived and the time on the bottom left-hand corner of the screen. Once the cart has arrived, all documentation should use the run time to indicate any interventions. If a Code Blue is called accidentally, do not panic. The team will assess the patient briefly and leave if they are not required. Staff should not attempt to cancel a Code Blue by contacting the operator. Once a Code Blue is called, it cannot be canceled. The ICU team will leave the unit if they are not needed. Ward staff will start a Code Blue record and document the brief activities that happened. There will be times where something just doesn't feel right. A patient might not meet every criteria, but your concerns matter. If your instinct is telling you something is wrong, call for help. This includes patients who may not yet meet the criteria for Code Blue, but whose condition is worsening, as well as situations where you have concerns and have not been able to discuss them with your attending physician. Any of these situations are justification enough for you to call a Code Blue. Calling a Code Blue is never a bother. We'd rather respond to a Code Blue and find a stable patient than for you to wait until it's too late. If you're concerned, trust your instincts and call for help. We are here to support you and the patient. After a Code Blue, one of 3 things usually happens. Number 1, patient is stabilized on the ward. This patient stays on the ward and can be medically managed by the attending. The chart stays on the unit with 2 copies of the Code Blue record, and the Code Blue review is given to the ICU nurse. The ICU nurse will also send any pertinent rhythm strips to the ward to be added to the chart via the pneumatic tube. Number 2, ICU admission. If an ICU admission is required, the patient will be transported with the Code Blue team while documentation and handoff are completed. We will need the ward nurse to come to ICU and give report. Please bring the chart. Number 3, an unsuccessful resuscitation. Unfortunately, not all resuscitations are successful. If this occurs, follow your unit's post-mortem procedures while the Code Blue team completes the documentation and reviews it. Regardless of the outcome, one Code Blue nurse should review the charting with the ward nurse prior to leaving. As long as the patient's condition allows, a Code Blue nurse will also be conducting a short debrief with the ward team. The debrief is an opportunity for us to learn from our actions and improve the quality of our patient care. Participation and input from the entire team is appreciated. In summary, the Code Blue team is here and ready to help whenever a patient, staff, or visitor is decompensating. When in doubt, call it out. It is never a bother to call the Code Blue team if there is ever a moment that you feel that you need help or are unsure as to what to do. We would rather be called when it's unnecessary than be called too late. Call a Code Blue by dialing 55 on any black desk phone or by pressing the Code Blue button on the wall. If neither option is available, shout for help. Things to do while you wait. Start chest compressions if indicated. A second team member grab the backboard, Code Blue clipboard, and resuscitation basket and stool. Pull the call bell out of the wall to signal for help. Send somebody to the elevator to meet the team and direct them where to go. Grab the chart, the MAR, and the Cardex. Once you call a Code Blue, it cannot be canceled, but no worries, we will simply do a quick check and leave if we are not needed. If you have any questions or need clarification on any of the learning you received today, please don't hesitate to reach out to your unit educator. We are here to support you and help you succeed. As a new member to the team, you bring valuable skills, perspective, and enthusiasm. We're excited to have you here with us and appreciate your commitment to safe patient care.